morning, everyone. My name is Kwon Lee, and I'm a student in Department of Korean Medicine at Usop University. My presentation is on finding of herbal medicine for infertility in polycystic ovary syndrome through network cluster analysis and animal experiment based on Korean medicine clinical practice guidelines. Here is the context. Polycystic ovary syndrome is a common and heterogeneous endocrine disorder. PCOS affects an estimated 5 to 18 of women of reproductive age, and up to 50 of cases are undiagnosed. It's typically characterized by anovulation, infertility, obesity, insulin resistance, and polycystic ovaries. Therapeutic options for PCOS have been reported to exert unexpected adverse effects. In healthy women, hormonal cycles regulate egg release for fertilization, whereas in PCOS, eggs couldn't be released because of hormonal imbalance in PCOS. Ovulation-inducing agents such as clomiphene citrate could be prescribed for PCOS women who want to be pregnant. However, clomiphene may cause side effects such as headache, dizziness, among others. So it's important to develop a new treatment of infertility for PCOS patients. Next, I'll explain the research methods. We selected a total of 18 prescriptions for female infertility from the Korean Medicine Clinical Practice Guidelines. Based on this data, we created two-mode network and two-mode linked network. Using N-4, we performed the centrality analysis to identify influential nodes. To perform network pharmacology analysis, we constructed a gene set related age and PCOS. Health genes were collected from TMMC and CTD, and disease genes were obtained from Malakas to construct the dataset. A total of 40 overlapping genes between health genes and disease genes were analyzed using cytoscape. The median values of the three topological parameters, such as degree, betweenness, closeness, was computed and ranked according to their magnitude. Based on the network analysis, we conducted animal experiments using a PCOS lab model. 36 female rats were divided into 4 groups. After treatment, serum, uterus, and ovaries were collected. Vaginial smears were examined daily to assess estrus cycles. Ovarian and uterine tissues were weighed, measured, and analyzed histologically using H&E staining. Here are the results of the prescription centrality analysis. In degree, betweenness, and closeness centrality, 온포종옥탕 was the most central prescription, indicating its major role in infertility treatment. In eigenvector centrality, 조경종옥탕 and 계율종옥탕 were central in edge-based analysis, while linked-based analysis highlighted 온포종옥탕. Next, for the house, Angelica Gigas showed the highest centrality across degree, betweenness, and closeness measures, confirming its importance in prescriptions. In eigenvector centrality, Angelica Gigas and Peonia Root were central in the edge-based analysis, while Angelica Gigas remained central in the linked-based analysis. At the 5 centrality values, the Angelica Gigas were all located at the center. Analysis of Angelica Gigas revealed that among PCOS-related target genes, insulin, leptin, and IGF-1 showed high associations. PCOS induction led to a fixed estrus stage, but in the groups treated with metformin and Angelica Gigas, cycle recovery was observed compared to the EV group. In PCOS, also the uterus and ovaries were reduced in size, but treatment with Angelica Gigas significantly increased their size. In the EV group, the ovarian follicles were increased, whereas in the age-treated group, their size was reduced. As shown in the graph, the number of cystic follicles were markedly reduced compared to the EV group, and the number of corpus luteum was recovered by the normal level. Onpozoltang and Angelica Gigas consistently showed the highest centrality as a key prescription and herb, respectively, for infertility treatment. Especially, the underlying mechanism of Angelica Gigas is closely related to the key targets of PCOS. It improved PCOS-specific phenotypes, including abnormal ovulation, ovarian structure changes, hormonal imbalance, and inflammation. This strengthens the validity of an integrated approach combining detox pharmacology and preclinical experiments.